who has a Global Health Foundation, and she's the executive director. Daniel, you maybe make your title clear to the rest of the participants. And then we have Debs Thompson, who is, I think, an alumni of People's Uni, and she will also talk about what she does. So I want to take this opportunity to welcome everyone. I can see there's Mr. Rodney Magwenya, there's Yonati Sepea, and others who have come that have not mentioned your names. You are really welcome. And we are going to have a good 1 hour of discussion about public health in Africa. This is public health knowledge to support health professionals in Africa. So at this minute, in the interest of time, without wasting any more minutes, I would want to hand over the microphone to Judith to start the presentation. But I want to echo this maybe, that to whoever has joined, those who have not read the chat, ensure that you mute your video and also mute your audio, maybe until when you're asking a question ahead there, you will unmute your audio so that we can hear you. So that will help us to avoid echoes and also maintain the signal stability. So Judith, I hand over the microphone to you, please.
Thank you. It's a great pleasure to be able to talk to the UUKHA membership. Don't know exactly who is on, but hopefully you'll participate in some of this conversation, either through questions or comments, and we'll find out who you are rather than letting everybody introduce themselves at the beginning. We've been friends of UUKHA for a while as People's Uni, and latterly have been working more directly with Henry, who were in the end colleagues in Uganda. And we can come back to that. But Henry's asked us to present about People's Uni, which is the organization we represent, but we also wanted to broaden this out to public health more widely, to give you a feel for what we mean by public health approach and why we want to teach public health to health professionals in Africa. And that part of the presentation will be by Debs. I'll then follow on with a bit more about People's Uni itself, how we deliver public health education online to low and middle income countries. And a special pleasure for me to welcome Daniel Iroegbu to the team, who is a recent graduate of our master's level program and has kindly agreed to give us the perspective of a graduate and a former student who's working in Nigeria in the field. So like many students, we've never actually personally met him, so it's a great pleasure to be connected in that way. I'll hand straight to Debs because we want to leave time for questions at the end. So Debs, can you please continue and take over from here?
Thank you, Judith.
The slides on.
Thank you. Okay, so welcome everybody. It's a great pleasure to be here, partly because my part of me is still in Uganda. I used to work in the Lira District Health Office back in 2010, so it's great to be connected with other Ugandan colleagues. And my role today is just to briefly outline some key public health concepts. And so to do that, I'm going to talk through a case study about HIV, because as you all know, for Uganda, that's a key health determinant. It's a key issue for both men and women and children. And so as we walk through this example, I want you to imagine that you yourselves work in a district health office and you have been approached by an NGO director who wants to establish a new volunteering, counselling and testing clinic in your district. And so we're going to look at what might be a public health approach to how we tackle that decision, how we make that decision. So just to remind us what that means, Judith, the next slide, we will be looking at what we mean by determinants of health. And for some people, this will be refreshing things you have learned previously or you use regularly, and for others they might be new concepts, new words, but always, you know, ask on the chat if anything isn't clear. So we're going to look at determinants of health, what drives health in our area, the epidemiology, which is how you measure health, what is working, what is happening already in your area, and how well does it work, and then how do we know what works, what's the evidence base. So to start with, to understand the picture of HIV in an area, it's best, we do this in the module that I teach on, is to look at a case study. So all of us will have come through professionally or maybe even personally with somebody who has HIV. And so if we think of our PO, she's a young woman, she's had a child out of wedlock, and she's been rejected by her family. She's had to move away from her village. She has some primary school education, but she can't find a job locally. And she can leave her child with a neighbour and work in the evenings, but those are her only options for getting money and for keeping alive. So in terms of thinking about what might put her at increased risk of exposure to HIV, is there anything on the chat now that anybody can think of in terms of things about her context, where she lives, that might put her at increased risk of HIV? Anybody got any thoughts coming through? Don't worry, you can just jot down. I know there's not lots of us, so in terms of her vulnerability, obviously, where she is only able to work in the evenings, and she may be, but she may find that she can only get money through becoming a sex worker or something like that, which might put her at increased risk of HIV. Also, her vulnerability, if she lives alone, that may make her more vulnerable to exploitation from men. And it depends what area she lives in. So there's a wide range of community factors and contextual factors which might put her at increased risk of HIV. But also, if you think about if she did contract HIV, what might be the factors which would put her at, what might be the barriers why she might not be able to actually go and have a test to find out if she was HIV positive. And some of those factors relate to how far away she lives from a test centre, but also how much she has to pay. If she's not working, obviously paying for the test is important. Or the fear of if she found out she was HIV positive, she wouldn't be able to pay for the results. The stigma accepted in her community, and she may fear that other people will be told. And also in terms of getting the results back, if she did go and have a test, then if the results don't come back quickly, she may have had to move on to another village or may not be able to go back. So all those factors make her to HIV, but also vulnerable in terms of her being able to access the testing. So when we look at the wider context, that's called the wider determinants of health. So let's look at the left side now and think about why that's important. So you can't quite see the bottom of that, sorry. The bottom of the triangle, if you could look at first, so prevent, screen and treat. Now looking at what systems we have to reduce the spread of HIV in our important this pyramid. So we obviously need to be preventing the spread of HIV, and we need to be screening us and making sure people are aware they've got HIV and they can access treatment. And in all of those, all of that system, we need to be aware, how does the wider context influence what makes people vulnerable? That's why we look at the wider determinants. So what often happens is when you look at, this is from my experience working in Lira district, when you look at the resources coming in to tackle HIV, the majority of the resources go to the top peak of the triangle, to treatment. And often it's focused on an individual intervention. And not necessarily taking account of the wider society and cultural things that impact on whether that individual can access treatment. And the screening and the prevention is it's more difficult to seek resources for that kind of thing. So one point is to look at the opportunities here you have with the Alliance in order to coordinate how organisations come together to coordinate those resources, and how to make sure that we are ensuring that we aren't just working on an individual level, but we're looking at the wider things that influence whether someone can access treatment. So take screening, for example. If you look at voluntary counselling and testing, you've got the NGO proposing that they develop a clinic. First of all, you need to look at what existing models you have. I know the AIDS Information Council have mobile clinics in Uganda that often offer mobile VCT, which is good for vulnerable populations. Also, there's the opportunity to deliver it as part of routine healthcare interactions. So if you come for maternity services, or if you come and you've broken your leg, this kind of thing, you can have an HIV test at the same time. And there are models where it's being delivered at home. And there's good research to show how different access to screening can be increased for different vulnerable groups, depending on which model you use. So it's important to to discuss that with the NGO director to understand what you already have in place in your district, and how effective is it. So when we think about all those things, we have to look at the wider fear, the stigma, the barriers that might affect why someone could access screening, and include that in our delivery model. So just looking at the circle in the middle, one thing that's important is when we are planning new interventions, we need to think, okay, what's already there, is it working? And then we need to develop a plan for what we're going to deliver that year and monitor it and evaluate it. And these are all key public health concepts which there's a real opportunity when you get people together who have got key understanding of those concepts and the skills needed, they can really work together to do that. And one of the challenges in LIRA was getting people on the same together in that cycle to do that planning. So if we go to the next slide, Judith. So in terms of what works, here it's about saying, okay, when we're planning what we do, how do we know what is effective? Is there any local data that's collected? So, for example, do any of you know what the VCT, the testing, the screening rates are in your district? How would you find that information out? Is it available at local data? How has it changed over time? And all those questions we want to ask, and want to ask, where would we find that data? Is it available? Is it available but not in, not at a national level but not at a local level? So it's important to understand epidemiology and data monitoring and how you might collect that data, how you might analyse it. And it's also important to understand the local experience and speak to clinicians, the community, to understand those wider determinants and the local context and how that influences HIV, and understand how people are accessing services as well and how effective they are. And then it's also important to be able to look at the wider evidence base to say there's been a lot of research in the and different models. What does that mean for our district? How to translate that research into vision for my area? So all these skills are key public health skills which in different modules we go into in more detail. But there's a real opportunity, I feel, with the UK-Uganda Alliance to bring partners together from a similar area and to look at how we develop those public health skills in that area. So I'm going to pass on to Judith now, who will look in more detail at People's Uni and our structure. Okay, thank you.
Thank you, Debs. And I don't know whether we said this at the introduction, but Debs is obviously a public health doctor jobbing in the UK and also working voluntarily for People's Uni, where she's a tutor and has since almost the beginning of People's Uni been involved as a module leader as well as part of the leadership group currently. So People's Uni, or People's Open Access Education Initiative, which is our whole name, and for very short we sometimes call it PU, is really what we wanted to talk to you about, because that's what brings us together. So let me take you back to the origins and the ideas, and apologies for this really bad photo, particularly to Dick, who is obviously not on the call. Professor Dick Heller is still the coordinator and one of the trustees of People's Uni, and obviously involved quite heavily still at the strategic as well as sometimes the operational end. But the idea for People's Uni goes back to him having developed two, not just one, but two online public health master's programs, one in Newcastle in Australia, and then again in Manchester, at Manchester University in the UK. And at that time, about 15 years or so ago, this was the first UK online Masters in Public Health program. And Dick had a background as a professor in public health, working internationally on in something called INCLEN, a network of clinical epidemiologists who basically developed capacity in that field internationally. And he was acutely aware that the contents, the public health training he was developing in this master's course was financially inaccessible to those who needed most, namely people in low and middle income countries. And there was a massive need for public health trained staff in those countries. And he was very aggrieved. And then in his retirement, basically with a few volunteer colleagues, set up People's Uni as a charity in 2007. And the mission has always been, as I've printed in bold here, to contribute to the improvements in health of people in low and middle income countries by building public health capacity via e-learning at very accessible, low cost. And that's what we still do, and that's what we go back to. We call this a social model of capacity building, and these are the basic building blocks. So this is really how we operate. We only engage volunteer experts in teaching and developing our courses, and these could be public health professionals, public health academics from any number of countries. We're a little UK and Australia centric, partly because of optic network, but increasingly getting out of volunteers also joining from Middle East, which is of course a wonderful development and what we wanted to do. The second building block is that we only use open educational resources. So we don't have a library, we don't afford books, neither do we actually to distribute them. We basically access and compile courses from what is already openly available on the internet and through other sources. So that's called open educational resources, and we package this into modules on an open source educational platform which is called Moodle. Some of you may know this if you've ever done an source platform. A lot of universities use when they provide online education, and so do we. And we have a very, very lean infrastructure, IT infrastructure supporting that. So the infrastructure and stuff with enrollment and student management processes and so forth, and help desk. So we also have very, very low bureaucracy and low cost bureaucracy because we simply cannot afford that. So student fees don't need to go too far really in order to be able to provide actually pretty high level, high quality education. We've published on this. There are some publications on our website. You can go back to this. That's just a screenshot of them. So how does this work? We've developed over the years actually 20 master's level modules which we offer on a semester basis. So twice students can apply for any module they want to take. And we've got them in groups of foundation science modules as well as health problem modules. I'll show you those on the next screen. And each module runs over effectively 11 plus 3 or 4 weeks. So in the 11 weeks you get taught, and then 3-4 weeks preparation time for the assignment at the end of the module. And the 11 weeks contain 1 week gap in the middle and 5 2-week topics, so chunks that we call TEP topics, and they're each taught by a different facilitator or group of facilitators. They're volunteer tutors, as I said. And that's to keep the workload between the tutors spread as thinly as possible, so that we don't overtax our tutors, because they all have other jobs, full-time and family commitments and so forth. They do this in their own time. And each of those 5 topics is fully prepared with learning objectives and outcomes, and a package of reading resources, which we package into a zip file. So you can see that we're decidedly low tech as well, because we don't want students to need an awful lot of IT online time, because that's very difficult to access and afford for students in the field. And there's an online discussion forum. Again, this isn't in real time. It's run over email. So anybody studying with us only needs an internet access and an email address. And the internet access can be periodic. It doesn't have to be continuous, of course. We have formative and summative assessments. As I said, there's an assignment at the end of the module. Formative assessment is basically you get tutor feedback as part of the discussion forum. And that's on email. So with 8 modules and the dissertation module, students can qualify themselves for a master's level award. 4 modules will be a certificate, 8 modules dissertation will be a diploma level award. And really importantly also, we run an alumni network, which Daniel is now part of, and that's what makes us fairly unique by comparison to a real university, because real universities don't afford the luxury of supporting their alumni as intensively as we can. So our alumni are held together in a network, and we try and support them in their next steps of their professional or academic development. More recently, we've developed 20 or so open online courses, which we call UUKHA, on a separate sister website. They're basically completely free self-study courses. Anybody can enroll on them and study them in their own time. You read the resources when you want. You can pass a quiz and you're going to get a certificate of participation. They're not tutor facilitated, so they can be studied at any time. And they concern themselves with introductory public health topics, so an introduction to public health, epidemiology, that sort of thing, but also specialist topics that you don't normally find on a master's course. So for example, climate change and health and so forth. So this is the promised list of master's level modules that we currently have available or have developed. Foundation sciences and public health problem modules. Of the foundation science modules, the biostatistics and the introduction to epidemiology sort of core our master's level award, because they're such an important basis for then actually getting through a dissertation module as well. Similarly with the evidence-based practice, which we highly recommend students take as well. And these tend to also be our most popular modules, together with health promotion. For example, health economics is also getting a lot of interest, and on the public health problems modules, those that are quite heavily subscribed often are communicable diseases, as you might expect, child and maternal mortality modules, public health, nutrition, HIV. Regrettably less popular still are global mental health and injury prevention and non-communicable disease modules, which I think is regrettable, because obviously these are growing of growing significance also in low and middle income countries. And as I said, we run a master's dissertation that runs over 2 semesters. That's a screenshot of some of the overview page of our open online courses, so you can enroll and register and study the material of each of these courses. That's just 5 of them. As I said, we run about 20, including in subjects such as medical ethics. So the size of the operation currently is we have way over 300 volunteers that have so far contributed to the development or the delivery of the modules. And I'm talking just about the master's level modules. More than 1,400 students have so far enrolled on any of those modules. About a third have actually not just enrolled and submitted assignments, but also passed them at what we consider the master's level. So that's a 50% pass mark. As you can see, not everybody continues studying with us, and not everybody passes a module. But of the students who we have formally enrolled on a master's program, a good 73% have passed, and the 73% are actually based on the 94 master's graduates who have graduated from our program, which was jointly run with Manchester Metropolitan University, which I abbreviate to MMU. So between 2011 and 2013, we were able to enroll our students in parallel onto a master's level program with Manchester Metropolitan University, which was entirely our program, entirely delivered by us, but MMU basically just delivered the master's level academic award and the qualification, and obviously the quality control as well that's associated with the university degree program. Since we have discontinued the partnership with MMU, we have continued the master's level program, and we have had more master's graduates since. So we're up to a total of 130 now. But of course, the current master's award is no longer a university award, strictly speaking. Well, it isn't. And I've added a line about our current fees in case anybody's interested in that. Sorry, let me just plug in my computer because otherwise we'll not see anything, all of us. Here we go. We offer places to high income country students as well. So if any UK students want to, or professionals rather, want to enroll on any of our modules, they can do so, very welcome to do so. For CPD or any other purposes, they pay a slightly higher fee, which we use to subsidize our infrastructure for the benefit of other people from low and middle income countries. So if you do register with us, you're doing some good as well as getting the education. And the picture of where the countries are, where our students and volunteers are coming from currently, you can see any number of countries are represented on both of those pictures, and there's a bit of a European predominance on the volunteers, but we're shifting that gradually to Africa and Asia. So we've got a lot of tutors from those countries as well now, which is obviously wonderful. What do our students and graduates say? These are just some snapshots of our student feedback surveys, which we run every semester, and some reflections from graduates, and a recent evaluation study as well of the alumni, the master's level alumni. What is really precious to me, and at the moment still based on very small numbers because I've only just asked this once or twice in the recent 2 semesters as a new question, I wanted to know whether what we do is actually considered relevant to low and middle income country settings by our students, and 95% of the students say so. So that's really precious to me. And 95% of students would recommend the courses to others. That's really very meaningful to us, because we don't want to be seen as a UK higher education provider. We want to be seen as somebody who does education that's eminently useful in low and middle income country settings. Practically all of our graduates consider themselves able to run public health programs. They use their research skills. Plenty of them had promotions and new jobs and salary increases, and about a fifth have enrolled in PhD programs since graduating from our program. they particularly value things like evidence-based public health. I've just thought I pick that out because it's one of those modules that often gets mentioned by our recent graduates in their reflective accounts when they say this was a real eye-opener to be able to access, to find, to retrieve, access and use literature from anywhere in the world in their own practice, and to learn the craft in doing that, and to realize how much is actually at their fingertips that doesn't cost money, and you don't have to necessarily subscribe to journals or buy books. There's an awful lot that you can actually glean from skilled searching and appraising of literature. Internet access is still an issue in the field, not in every country. I'm not sure quite how it is in Uganda, but we have countries that struggle a lot more with internet access than I'm aware of Uganda. I've done a recent survey of students. It is still an issue, and as long as it is, we are decidedly low tech in our delivery, and we make allowances for this, of course, but sometimes it does remain a barrier. What about quality? I thought you might want to know a little bit about that too. So from the beginning, we've had support by one of our key partners, the Royal Society of Public Health, in course development in particular. And as I said, we are keen for low and middle income country representatives to be part of the module development teams to make sure that they are addressing what is actually relevant in low and middle income countries. Every 3 years we review each module at least. There's ongoing reviews going on as well, of course, in response to student feedback and volunteer reflections. We have an education committee which is basically functioning like an exam board. It's made up of all the module leaders, all the master's level module leaders and some of the academic leadership. And we have a separate leadership group as well, which takes a closer look of, which takes closer oversight of the quality issues. We've got an extensive student support system, which includes a pre-study course. So if a student enrolls new with us, they first get enrolled on a free, what we call preparation to study course, where they get introduced to our systems and our online systems and the structure of our courses, and learn how to study with us. We have student support officers on each module, and we have an extensive student corner as part of our online system, which is where they find a lot of study resources. Interestingly, that's used by a lot of other people who are not part of our student body, but find the student corner resources through internet searches and use them to basically access resources on academic study skills. The other thing that isn't often appreciated by traditional educational institutions who don't run operations online, there's absolute total transparency of operation, because everything that a tutor says to a student and vice versa is visible and auditable. So the module leaders, as well as I as the academic coordinator, can review every exchange on every discussion forum, and that provides an instantaneous quality control, of course. Now, a question you might ask as well is about accreditation. As I've said, we had a partnership with Manchester Metropolitan University, and they have obviously fully validated and accredited our program previously. We no longer have that partnership, so we no longer have that accreditation, and our graduates no longer graduate through the university with a university degree. However, obviously we still hold true to providing master's level education, because we continue to deliver effectively the same modules and the same program, if anything beefed up. Our alumni, the master's level alumni, are able to apply for Royal Society of Public Health Fellowship, which is the type of membership with the Royal Society, which is only open to people who have master's level or equivalent public health education plus a career commitment to public health. So, of course, RSPH decides on an individual application from any of our alumni but our alumni have gone through this process, and that's something that they do appreciate as well. And obviously is a quality mark. The external examiner has obviously confirmed as part of her role with MMU that we run an equivalent program to MMU in other universities. The last bullet point is about what is called the Agency for Public Health Education and Accreditation, the European body, which has approved 3 of our modules, because basically we've never applied for more than 3 because we cannot afford to apply for more. It's as simple as that. I'm also not quite sure this is particularly valuable to us as individual module accreditation or to any of our students. So what does the future look like? We are and continue to seek partnerships with universities where that is meaningful to them. I think latterly that's been difficult with UK universities, completely understandably, I have to say, because obviously the financial realities at the UK Higher Education Institute are such that we would probably be seen as not worth their while or as competition. So that's really why I think that we actually got links to universities on practically every continent, and we'll continue our conversations about that. We offer more continuous professional development, partly as our offer, our online open online course offer, but also with one of the London organizations to develop a public health CPD program for their health professionals. So that's an exciting development for us. And we have always offered lifelong learning or career-long learning for people, but it's probably something we want to write more prominently on our banners, because we've got the smaller courses, the introductory courses, and master's level modules, the whole master's program if anybody wants it, and the alumni support. We are keen on developing more partnerships with healthcare organizations, charities, as well as educational providers, both in the UK and abroad, and we're currently talking to Faculty of Public Health Africa, Global Health Exchange within what is called Health Education England. There are all sorts of exciting opportunities which we're currently pursuing, and we are in a position to offer the educational platform to organizations for their own courses. If anybody's on the call who is aware of any course that anybody needs to run or would like to run online, we've got the infrastructure to offer to do that if anybody wants to explore that. So in summary, this is really where we are. It's an educational innovation. It was a good idea. It continues, and it's really developed into a sizable operation, but remains very flexible and still scalable. So we can adapt to particular student groups. We can adapt to particular organizations in a partnership. We can fairly rapidly develop courses and deliver them on the existing infrastructure. And we are still eminently accessible to people that we want to be accessible to in low and middle income countries. IT infrastructure obviously notwithstanding. The organization and what it's done has been evaluated very positively by students and alumni, and we just also need more visibility, which is partly why we're on this call. Because so far we have been spreading ourselves by word of mouth almost exclusively, and we're not particularly social media or marketing savvy, because we are all public health people who want to do this because we want to do this and haven't really got the marketing skills amongst us at the moment. So this is really all I wanted to say about People's Uni. And without further ado, you can hear from Daniel what it really feels like at the receiving end. Daniel, do you want to unmute yourself if you are muted?
Yeah, I'm mute. Can you hear me now? Yeah,
we can.
Good afternoon. This is Nigeria. I'm Daniel. So I'm the CEO of the Iroegbu Global Health Foundation. I'm a People's Uni alumni. So I'm going to talk on the impact of PU on my public health work. So our organization is a non-profit and non-governmental organization registered in Nigeria. The organization works to improve health, raise awareness, reduce diseases in our society, especially in the hard-to-reach rural community. The organization is a member of Water Supply and Sanitation Collaborative Council as a UN-affiliated agency under the United Nations Office on Project and Services, and we belong to some networks such as Sustainable Sanitation Alliance, Global Hand Washing Partnership, Sanitation and Water for All, the UNICEF network, and Global Water Partnership, Rural Water and Sanitation Network. So we do much work on the health and water and sanitation. Yeah, next slide, please. Okay, so we have some intervention program. Currently, the organization, in partnership with Vitamin Angels United States and the Federal Ministry of Health here at Abuja and National Primary Healthcare Development Agency, we are distributing vitamin A and multivitamin supplements, and they want me to under 5-year-old children, lactating and pregnant women at risk of malnutrition and anemia in hard-to-reach Nigeria. Because actually, most of the government actually provides some of these commodities, and they don't really get to the hard areas, hard rural communities. So we have to actually network with the government through the partnership to really extend to people in the hard to rural community, because some of these communities need to pass water. There's no bridge to get some of them. So this is one of the intervention programs that we are currently doing. Okay, now we have under our public sector partnership, excuse me, the organization, we also partner with Always Nigeria, that's Protea and Gamble, to distribute over 2,000 sanitary pads. This is a disposable sanitary pad to schoolgirls and rural women of reproductive age to manage their menstruation in privacy, safety, with respect and dignity. Because I carried with the impact of People's Uni master dissertation, I've been able to carry out some research on menstrual hygiene management, among physically challenged girls. So I found out that some of them are using various materials, such as pieces of rag, tissue paper, many stuff that are not hygienic to manage their menstruations. So that's necessitated partnerships. So we're also currently talking with Transformation Textiles and Relief Safe for domesticating the production of reused in Nigeria. So that will help us to distribute a dignity kit for these young girls. So the organization is also mobilizing and engaging key stakeholders, the government, the private sector, the donor agency, the schools, community and religious group, women group, media, and the healthcare professionals against cultural, religious, and traditional restrictions and harmful practices against menstruating women and girls. So there are a lot of issues or misconceptions. There's a lot of negative attitude that are surrounding menstruation. So we are also mobilizing currently in order to effectively help the girls and the women to manage their menstruation in privacy. Okay, next slide. Okay, currently we also partner with the Enugu State Universal Basic Education Board to engage in school-led total sanitation. And also the women group, like in the Southeast Nigeria, there's what they call Women August Meeting. So we found out that it's a very strategic approach or strategic group for us to actually penetrate the communities by educating them on menstrual hygiene management, safe menstrual hygiene management. So we also partner with the religious and the community leaders, our community-led total sanitation, which we have also published some papers at in community-led total sanitation website, courtesy of my dissertation work from People's Uni, which my supervisor, Dr. Petra, was really contributed much, and Professor Lola they actually did much work to help me in literature review and data analysis and some of those stuff, which has also, I will still come to that. So this initiative is greatly attributed to the potential gain through people unit education. So I have to commend the people unit. They have actually, I would say that their objective is being maximized or being attended, because it has really improved my skills in public health and research and some of that stuff I'm doing right now. Okay, next slide, please. Hello. Okay. Now, a part of people unit me. Okay. You skipped one. Okay. Now, people. Okay. Okay. People unit study have given me the opportunity to pursue my desire. I've always desired to do a public health career to improve livelihood in Africa. So I have a global perspective of public health. So it gave me the opportunity to actually pursue the public health career, which I have dreamed and desired to do. So through the modules and the ground tutors drawn from different countries and backgrounds, they have actually, they were able to do justice to the courses that I was taken around, that I undertook on the road. So I cannot fully estimate the potential impact of this learning platform in my public health career. It's really created a high level impact on my public health career. Okay, the next slide. So I was also able, okay, to enroll on epidemiology based statistics. So in the epidemiology, I was able to study the disease occurrence and every aspect of disease, and the biostatistics, given the sampling techniques and method of data collections. I did health economics, inequalities, and social determinants of health, where that motivated that gave me an insight on the impact of WASH, that is water, sanitation, and hygiene, on maternal and child health care. Now, in Africa, even in Nigeria, children die of diarrhea because of poor water, poor hygiene. So enrolling in social inequalities and social determinants of health actually increased my knowledge on looking beyond some communicable, but looking at the non-communicable diseases that are caused by water, by poor sanitation, and also the inequality that exists between the rural and urban, and even in the urban, the urban slum and the urban cities. So there are a lot of inequalities that exist when we talk about the universal health coverage. So this thought actually guided me and gave me more insight on those things. And evidence-based health practices, like currently I'm in Abuja, the capital of Nigeria. So now we are doing a budget tracking on the web. So we are talking about evidence, the use of action plans, how to use data to formulate a policy, and also to engage in advocacy and as well the policy makers. So I also do a public health concept for decision making. So those courses actually helped me, and also public health nutrition. So that was when I was able to see the need, the public health or nutritional need in my community, and that helped me to look inward. I also undertake a course in academic writing that really boosts my writing techniques and skills presently. So the dissertation model centered on systematic review. So it was standard. My tutors, my supervisors, they did much work. They look at the work and make sure that I follow the steps, the internationally recognized standard of literature review, where you need to compare different database, and not just comparing database, you bring out and you see and you collect the paper that are relevant and sieve off the ones that are not relevant. So it was really granted for me to undertake that dissertation course that leads to MPA. Okay, the module greatly influenced by use of evidence-based for public health intervention programs such as the community-led total sanitation, to reduce the incidence of diarrhea-related diseases in the hard-to-reach rural communities, and also the course as well equally broaden my scope in attaining the sustainable development goals in Nigeria when it comes to the social determinants of health on maternal and child health, in order to gainfully engage in reducing maternal and child health mortality, which the recent UNICEF publication, which Africa still has some high rate of maternal and child mortality, and which we need to tackle collaboratively. We need to tackle by improving our knowledge base on what is the problem. Okay, the public health concept for decision makers and the social determinants of health will strategically position me on stakeholders and policymakers' engagement on inequalities and disparities in rural and urban populations' health and the people in the slum. Okay, we can also see this dissertation was a catalyst towards my research development. Like currently, I have conference proceedings and systematic reports, synthetic reports, which I have developed. I have published in conference about 2 papers and 1 synthetic. I've also published some that are yet to be accepted. And by November, if I gather resources, I should be in Brazil for World Hepatitis Alliance, not to present my paper on the assessment of knowledge, attitude, perception, and sources of information regarding viral hepatitis and more healthcare trainees. So thank you, and trust that you may have a question to ask us at this point. Thank you.
I want to appreciate the team that has presented today. Many thanks to you all. We value you, and we are happy to have heard from you, the team People's Uni. And for the team that has been attending this talk, it's now a time for us to give some reactions, comments, and questions to the team that has been presenting to us. So if anyone has a question, we are unmuting you. Timothy, please unmute those people. Just say out your question loud so that everyone can hear it, and then the team will be able to respond. Anyone with a question, a comment, or a compliment? Timothy, unmute all participants. It's time for interaction. Hello, friends.
Yes, this is Francis from Uganda.
Hello.
Yes.
Yes, thank you for the presentation. It was really good. I wanted to ask you something about the partnership between our organization and the People's Uni regarding the exchange program for people from People's Uni, if they are able to come and volunteer with some organizations like in other countries like Uganda.
Sorry, can somebody repeat the question? Or maybe I'll try. Was it about whether somebody from our organization could come to volunteer to Uganda?
Yes, like from People's Uni coming to volunteer.
Yeah.
Something is
So normally we don't do we haven't actually sent volunteers abroad because it's not within our budget. So it's not how we've set up the delivery. So we're completely online delivery at the moment. I know this sometimes comes up as a question, can we run maybe a joint program? Because what we could do, of course, if we were joining with a more local organization, would be what's called blended learning. So we provide quite a bit of online course delivery, but also a bit of direct face-to-face delivery by somebody in country. So that doesn't necessarily require one of our volunteers to go to Uganda. It might be that a Ugandan colleague who has sufficient knowledge and skills, or the appropriate knowledge and skills, can actually support the training of others in country. That's one option of looking at blended learning. We have obviously quite an extensive network of volunteers and alumni who we can use to ask whether they would like to go and volunteer for a particular role. We can always do that, but that wouldn't necessarily be under the auspices of People's Uni at the moment, but we could look into that.
Yes, thank you. Any other questions?
Questions? You just send them to casual if you can, if you are going to process them today. Then we'll just use them from there later. So if it's 30 minutes, then I will have to come back for them.
Hello, anyone with a question, a comment, or a compliment to the presentation by our three presenters?
This is Johnson from Kenya.
Hello,
Yes.
So many questions.
Yeah, I think I really want to appreciate the team that organized this meeting using this platform. I think it went well. Everything was very clear, and can get it Nairobi, Kenya. Yeah, that's my location. So otherwise, maybe a comment that maybe for the People's Uni, maybe tutors and volunteers, we might want to utilize this platform as one of the ways in which you can be able to strengthen the interaction of students and the tutors and all other alumni group. So otherwise, it was very good, and I'm happy to be associated with People's Uni always as an alumni.
So Johnston is one of us, and he obviously joined the conversation today because we've opened the invitation up to our students as well. And Johnston is no longer a student, as he said, he's an alumnus. But at Johnston, is a very good idea. I like Zoom as well, and I think we should look into using that more to talk to each other as well, because we don't so often get a chance to do that.
Yes, I have seen a question here by William. William Nkata Masembe has, I think it's a comment, partly a question. It reads, I don't know whether Judith, you can access that, or Daniel. He says that I think the idea of People's Uni is partly about cost reduction. So the idea of volunteers is good, but not to travel from abroad, but to promote local volunteers with the skills to join up and contribute. If this is a possibility, what would be the best way of recurring such volunteers? Recruiting such volunteers, yes.
So if I understand this correctly, William, this is the idea to actually include more volunteers from more locally to Uganda, for example. William, are you still on the call? William is muted, I think.
William is muted. Please, Timothy, unmute William.
Yeah, I think he's unmuted. So William, we welcome any volunteers. What I'm looking for normally is somebody who has a master's level education in public health, if they want to join us as tutor volunteers. And then they can be part of our tutor team, and they'll be introduced to tutoring by a more experienced tutor and so forth. So we are really, really keen on spreading this further and making sure that we train trainers. It's been built up as a train-the-trainer model. So if volunteers want to come and join us in order to be able to train locally, that would be perfect. What if one has transferable skills? Well, the same applies. What do you mean by transferable skills, William?
I'm thinking that for example, mental health, but not MPH. Okay, not in public health.
Yeah. We should look at that offline probably, because we've gone beyond 3 o'clock. I'm just conscious of other people's time, but I'd be very keen to talk to William over email or Skype directly if he wants to explore that, or anybody else.
Important statement that we've actually gone beyond the time that we had planned. It's 6 minutes past. For all those that had some other questions, we are going to share this whole video on our YouTube platform. And if you need it personally, we can also share it with you. We shall need to share your emails, and then we give it to personal emails. We are very glad on behalf of the Alliance, Uganda UK Health Alliance. I want to appreciate everyone who has attended this talk, and I want to encourage you to always attend. We are going to have another talk this next month. The talk will still be on 26th. Actually, it will be on 26th of October. Please block your diaries for that date. We shall confirm the presentation and the presenters in the course of the month. Otherwise, I appreciate everyone, and we shall always be keen to ensure that we foster shared learning, joint working, and co-development on the side of the Alliance. Thank you very much, everyone. Have a nice evening and afternoon that side.